Hello, everyone. Dr. Maria Sampoulos here. Pleasure of having Yazan Gammoh with us today. He is an optometrist in Jordan, well known all over the world for all his contributions to optometry. It is such a pleasure to have you on the show today.
Thank you, Maria. Thank you for hosting me, and thank for the all audience who are listening to us.
For those of you that do not know him, he is an optometrist in Jordan, holds a PhD in optometry and vision sciences, and a master's in optometry from the University of Brantford in the UK. He's associate professor of optometry and chairman of the optometry department in, and I'm sorry for butchering this, Al Manman University.
Via Amman University.
Apologize. And so, senior optometrist at the Arab East Medical Supply. He is a consultant for the Lions Club, chair of Continuing Education Committee and Optical Professionals, a higher medical council, Ministry of Health in Jordan. Also is a fellow for contact lenses, and educator of the year in 2017 in Europe, Africa, and Middle East. I mean, global awards, Peter Ackland Award in 2020, Dubai Conference ambassador for 2020. Also holds an educational chair for the World Council of Optometry. Has so many different influences for optometry all over the world. So it's such a pleasure to have you on the show today.
Thank you, Maria. Thank you.
Yeah, I mean, you're global, so you know all the struggles that optometry has all over the world. And one of the big things for this, global podcast interview of leaders all over the world is to show optometry how it's so different all over the world, and how much more work we need to do. Can you just give us just some quick history on your education in Jordan, your journey, and how you got to starting a first program for the university?
Yeah, can you imagine that? Well, basically, let's go back to 1999 when I graduated from high school and I wanted to choose a major. And I was telling one of my cousins who studied in the UK, and she was the first female Jordanian to open an optometry practice. She told me, Yazan, why don't you just go back to the UK and do optometry? I told her, I don't want to leave my country. If I can find something here, I would prefer that. And my father actually approached one of the universities here in Jordan and told them, listen, this profession is very lacking in our country. Can we do something to support that? And we sat with the ophthalmologists association, with the opticians associations and the university, and we said, well, let's start the first bachelor's degree program in this country. And what we did, we approached several organizations worldwide, such as the World Council of Optometry, and we talked with some of the nonprofit organizations, and they had few optometry doctors from the US who were veterans and actually supporting the work of charities in the Middle East. And they actually suggested two names who joined the faculty and supported the program. And hence, the first program was born. 20-something years later, I decided, well, we don't need only just one optometry department, we need two, because we have very few in the Middle East region, and we started a new one, me chairing it, also again, asking support from the regions, and thus we have graduates from at least 10 different countries around us. And yeah, we're fortunate that we reached to a bachelor's degree level. Unfortunately, we're eons beyond what's going on in the US and even in the UK. Can you imagine we don't have a therapeutics license? Even diagnostics drugs use is only allowed within hospitals under supervision of ophthalmologists, even after 20 years of education with involving US and UK teachers, and still we are at that level, unfortunately.
Yeah, a lot of the interviews that I'm doing I hear a lot of that, and it really frustrates me because we have so much education, we do so much, we are really primary care for the patient, and it's really frustrating to see all these struggles that optometrists face all over. But I think you're taking the step. I mean, you're doing a lot to help and with your role in the education committee for the World Council of Optometry, what are you doing to kind of help with education and move forward and trying to help with scope practice with that position?
I'm glad you asked that question. Just a couple of weeks ago, the WHO has released their competencies framework for eye care professionals. And the interesting thing, at the WCO level, we are moving from the old system of reviewing programs, and we are focusing on competencies-based optometry programs. So hopefully in the next 3-4 months, with the committee members from all over the world representing the 5 regions of WCO, will be hopefully by the end of this year releasing a document, a competencies-based curricular support elements to hopefully support programs like the one we started in Jordan, others that have started already but still evolving, and those who are planning to review their programs to use the hopefully released by the end of the year document to think about their programs in strategic ways. I'm currently writing a manuscript about the situation of education in the Middle East, and one of the people who are working with said, well, can we look at it from a competencies-based point of view rather than just curriculum and titles and the old-fashioned system? So we hopefully by the end of this year, the WCO chair committee and the committee itself will be releasing this document that will be aligned with the WHO document, hopefully raising and actually moving optometry from just personal and regional efforts to a worldwide effort, hopefully.
Yeah, hopefully it takes time, but I think there's a lot of passionate people that I've spoke to, you as well, that really want to move it forward. And I think just with perseverance, we can. I mean, and I think with the WCO and other optometrists all over the world trying to say, hey, here in the U.S. we have diagnostics, we have therapeutics, and patients are better outcomes for it. Why not help support our colleagues overseas as well?
Indeed.
The other thing that I was really impressed was, Educator of the Year in different countries, continents as well. And that's why I wanted to have you on the show and give us a little bit of a background on that. How is, contact lens education and training different in the Middle East and Africa, and just so we can have some understanding here in the U.S.
Yes, I would like to thank actually FIACLE, the International Association of Contact Lens Educators, whom I'm a member and a fellow of. They thought my work in the region was worthy of an award back in 2017. Went to the UK, attended the BCLA and received the award. Basically, what we were thinking of doing, for example, Jordan started that personal effort. Other countries like Lebanon, Saudi Arabia, Sudan, Egypt, each country, they wanted to do something. But unfortunately, due to the lack of optometry programs, some countries don't have it at all. Some do not have enough educated and skilled educators. So what I did through the East Mediterranean Council of Optometry, the regional representative of WCO, I sort of moved from one country to other in a period of 2 years, carrying out a structured training program for both educators and final year optometry students, where we train them on basic contact lens skills. For example, in Sudan, when I went there, I found out they only use, can you imagine, yearly contact lenses, the old-fashioned ones, because with the war issues, poverty, people can't even afford a monthly disposable contact lenses. So trying to educate the educators and the students that are other options available. They didn't even understand what a scleral contact lens is. So I brought a couple of sets with me and I kept them there at the school. We did a 3-day program there. And then I did a 6-month follow-up program with them to see, did they utilize these lenses well? Did they understand? I was able also to contact some companies in the US and bring some samples. We saw some patients and brought them some lenses free of charge. The companies did not charge us, and we did serve the community. We started like a contact lens clinic back there, and that effort was almost replicated in 3 or 4 other countries. So they thought, well, I was worth an award, apparently.
You are worth an award. I mean, doing a lot. I mean, just helping patients that can't afford it, right? I mean, it's super important and making a difference.
Yes.
We've seen videos and doctors doing mission trips and things like that that make a huge difference on simple things that we take for granted here in the US. So,
Indeed.
I applaud you for your efforts there. You're also, I mean, taking it to the next level with, the WHO organization and with vitreoretinal disease and things like that. Give us some information on that, because I think that's important too, as we kind of try to expand scope. I mean, even to like retina instead of just, anterior segment disease.
Indeed, indeed. My passion is basically low vision. People don't really know that. They think of me as a contact lens educator, but when I started training, I was involved with low vision patients, and I thought, well, these are a marginalized part of the society. Most of Middle East and Africa don't see low vision patients as patients that can be helped. Just let them do whatever they want to do and put them at homes and just get them out of work. So we thought, well, no, optometry can do much better than that. And with other eye care professionals not able to serve the whole community and think about low vision patients as well, who mostly have vitreoretinal diseases, I was approached by WHO through the WCO a couple of years ago to support eye care packages that are targeting the ministries of health or departments of health at the governmental level, thinking how to actually provide accessible, equitable vitreoretinal management strategies through primary care, through optometrists first, training optometrists how to detect diseases before they become way advanced and there is nothing that we can do. Allow and train optometrists to perform certain activities or certain interventions that are not surgical, but and not very invasive, but at the same time allowing, for example, diabetic retinopathy patients diagnosed at least 5 to 10 years earlier, which will actually support and help that patient in providing a quality of life and quality of vision earlier than when they are getting diagnosed by a tertiary eye care center, which they need years actually to go through, or maybe sometimes becomes too late. And even with the interventions or with the vitreoretinal interventions, basically the damage is already done. We're just preserving whatever sight that is left. And actually, the other part of that is asking ophthalmologists to refer these patients as early as possible, because sometimes there's nothing I can do with these patients except with just empathy and just listen to their issues. Most of the time with the low vision clinics that I do in the Middle East, I just simply listen to patients. I do not do any low vision intervention because their vision loss was irreversible due to we're not being able to be detected early, unfortunately. So that was really the work of WHO in that.
Excellent. Optometrists that are going to be inspired by this video and all the work that you do, what can optometrists do all over the world to kind of help support your efforts and what you're doing and optometry in other countries and things like that? What can we do? My thinking was, hey, just, join the World Council of Optometry as a member, kind of help support that with a small membership fee, and you get a lot of education. Anything else that, optometrists can do to help you? Because you give a lot back to optometry, and it affects all of us. I mean, it doesn't matter if it's in Africa, it affects all of us. We're a global community. Like I've always said in a lot of these podcasts, a lot of companies that are overseas will come to the US they might lobby against us and say, hey, we do this in Jordan. It's just why do we have to do this here in the US? Things like that. What are your thoughts on that?
Well, to be honest with you, the distribution of eye care all over the world is not really um, as appropriate as we want it to be. There are some countries where optometrist to population ratio is like 1 to a million. Can you think about these things? You wouldn't think of a developed country like the US that these things are happening, but in certain countries, unfortunately, this is going on. The majority of avoidable blindness and low vision is due to simply a patient does not have access to a simple pair of spectacles. Some parents, I've seen that all over our region, Middle East and Africa, and even parts of India. I do a lot of work in India as well. The mother and father say, well, we cannot afford $10 for a pair of specs. Maybe just let the girl sit in the front of the classroom. We have like 2 other children. Maybe she just doesn't have to study beyond the age of 10 or 11. Some children are left behind just because the parents cannot afford a pair of specs. Even if they can manage miraculously to bring them, if they broke, they cannot get them repaired. They cannot enforce their children to be compliant with wearing these glasses because of, unfortunately, the bullying that's going on among the children. So I think optometry worldwide should support other countries which do not have accessible, equitable eye care. For example, if you can join the WCO, that will be great. You mentioned that. But the thing is, we need to support the public health efforts and the educational efforts. The good thing about the WCO, and I would like to use your platform to advertise about that, it's a membership, a free service. There are 2 fellowships that WCO offer. A general one, that will, if, for example, if you come from a country like you, doctor, the US is a member of WCO, and you approach another country like, for example, Jordan, which is also a member of WCO, and you want to conduct a protocol to support the Department of Health in screening school children, which something doesn't happen in our regions. We don't have school-based screening programs anyway in many countries in the region. So you will apply for the WCO, for example, and they will review your application. And if it seems that it meets the standards, they would support you to come to our region for a few days and support the public health efforts. Another thing, if you are an educator, you can talk with another academic institution and come as a mentor for at least a week. Develop a section of the curriculum, support the work in the clinic. And this is something that WCO is supporting. And lots of optometrists worldwide are not aware of such efforts. So if they go to the website and if see they are eligible, I would encourage them actually to apply. There are a few fellowships there waiting for someone to grab them, to be honest with you.
Thank you. Just in closing here, what do you think the future holds for research in optometry? Because you do a lot with that, and interested to hear your thoughts.
Good. I'm actually supervising now a student in an institution in South Africa, and we're looking at interventions at this primary school level in terms of myopia. Myopia is on the rise. It's becoming an epidemic, and lots of companies have introduced contact lenses and ophthalmic lenses that will actually manage that progression. But if you imagine a country that you are not even allowed to actually assess a child, you're not allowed to fit a contact lens to a child, and you cannot ensure compliance with spectacles, what can you do then? So I think the future of optometry research should focus on providing management at the schools, at the primary level, integrating teachers, parents, and practitioners, engaging them all at the same level to ensure that parents are aware of such management strategies, teachers understand the need for these things, and ensuring that practitioners have the competencies and the scope to allow them actually to offer these interventions to the students and the children.
I want to thank you so much for joining. It was an inspiration to have you on the show. I mean, all the work that you're doing all over the world, different countries. Thank you so much for what you're doing for optometry. If I can be of any help or anything, you can always contact me. Send me stuff. I'm happy to share it on my platform. It is one of the things that I really want to help, expand scope and optometry all over the world and help patients. Because, like you said, that story with the young girl, unfortunately, that can't move forward because the parents can't. It really breaks your heart. It's unfortunate because those things here in the U.S. we don't even think about, because there's services programs here that help and that thing. So it's unfortunate with something so simple as a pair of glasses. So sometimes the mission trips help and all those things help, but maybe it's just having more optometrists in that area do that, and just with increasing scope and what more we can do. So thank you so much for joining us. It's such a pleasure.
Thank you so much for your time and effort, and thanks for the audience for listening to us. Take care.